talking about society's challenges, we had a huge challenge this year. So COVID-19 was presented as a social challenge to the universities this year. The response of the universities was fast and consistent. But how can we show the impact of the universities facing this specific challenge? I will briefly present the response of the São Paulo State University, UNESP, to COVID-19 pandemic. And I would like to start with a question. What can we learn from UNESP's response to COVID-19 pandemic? Like USP and Unicamp, UNESP is a public state university. And as you can see in this slide, UNESP is a multi-campus university, and the campuses are located in 24 cities across the state of São Paulo. So how was UNESP's response to COVID-19 pandemic? On March 24th, quarantine was decreed in the state of São Paulo. 3 days later, on March 27th, UNESP created a scientific committee coordinated by Professor Célia Regina Nogueira de Camargo with the purpose of directing research efforts in order to follow the evolution of the pandemic and seek improvements for the prevention, diagnosis, and treatment. Under the coordination of the scientific committee, new research groups were quickly formed, which resulted in the proposal of 102 projects very quickly, very fast. I also highlight the creation of the website that brings together UNESP's research and other important actions related to COVID-19. But now, returning to the projects, they were grouped in different areas. For example, developing new technologies, developing new treatments, diagnosis, epidemiological studies. But it's interesting to note that research projects were not limited to the area of health and biology. As we can see in this slide, projects were also proposed in areas of humanities and informatics and information science, covering all aspects of the pandemic. In parallel, a network of technical scientific expertise in diagnosis was identified, and the UNESP COVID-19 Diagnostic Network was created and became responsible for carrying out diagnosed RT-PCR tests for the coronavirus. The laboratories in São José do Rio Preto, Araraquara, and Botucatu campus became part of the testing platform of the government of the state of São Paulo and was accredited by São Paulo State Department of Health. So far, this network has carried out more than 90,000 RT-PCR tests, 40,000 of them in partnership with Embraer, with the financial support of Embraer. So I'll give you a few more examples, just we can have a picture of what happened at the university. So Hospital das Clínicas of the medical school that is located in Botucatu assists 68 cities and was very important for the assistance to patients in the region. So there are 60 cities that benefit from the assistance provided by Hospital das Clínicas. The Araraquara campus, the Chemistry Institute produced alcohol gel to distribute to low-income families and for people in social vulnerability. The law school that is in the Franca campus, provided legal guidelines on issues related to the pandemic. At the very beginning of the pandemic, a group of geography researchers from Presidente Prudente campus carried out a very interesting study on how the movement of people influences the dissemination of COVID-19. Another example is what was done in the schools of engineering in Ilha Solteira and Bauru that produced face shields for health professionals. I could spend all afternoon here putting cycles around the campuses and pointing the actions that they took toward the pandemic, the COVID-19 pandemic. But of course, we don't have time for that. This is just to show how all this goes along the whole, across all the state of São Paulo. Another thing that is important to mention is TV UNESP or UNESP television that produced a special series of programs dedicated to inform about COVID-19 pandemic. So what we can learn, what is response? This is just an example. We have much more things that have been done, but what does this response shows to us? That is that research articulated around a social demand or a social challenge is a way to put all the knowledge produced at the university available to seek solutions to a concrete problem. So that make it easier to find the indicators for social impact. Transparency and communication are very important so that everybody can have access to the knowledge that is produced at the university. And also, and it's very important for UNESP, this response articulated to a concrete social problem strengthens the links with the local community. So thinking about, just very quickly, thinking about indicators, we can suggest that the number of faculty and hours dedicated to these projects that will generate results is an indicator that how the university is involved to solve real problems of the society. How these results turn out in public policies and also contributes for products and services that will be important in treatment or any aspect of the, in this case, COVID-19. All of these websites and TV programs, the number of access to these websites or TV should be also an indicator of the impact of these contents that were available to everybody. And the other thing is this strength, the stronger link with the local community that can be reached with this articulation of research and a social demand could be measured by a reputation survey on how the general population or the local community sees the university and its contribution to that particular problem. This would be also relevant as an indicator of social impact of the university. So this is what I have to show to you, and thank you very much.